Well, testing for the coronavirus is getting faster and less painful for patients. In Philadelphia, NBC 10 investigative reporter Mitch Blocker found a new nasal swab that may help scale testing. Mitch.
Aaron, today we saw this nasal swab and this testing capacity up close. It is much smaller than what we've seen doctors and nurses using when they are testing. It's about the size of a Q-tip, and the doctors and nurses who are doing these tests say it will help them test more people.
Okay, here we go. One. That's it. You did it.
New COVID-19 testing swabs arrived by the bundle in Southwest Philly.
They sent us 250 of them, which is huge.
The test was very easy, much easier than I have heard from other people.
Instead of sticking a swab all the way to the back of the nasal cavity, the new swabs barely go past the nostril.
We are running through the test. I mean, it's like as fast as we can do this, do a swab in the nose, 5 seconds in each nose. I mean, it's basically 3 to 5 turns in each nostril, and that's it.
The Health Annex in Southwest Philly offers drive-up testing every Wednesday. The nurses doing the testing call these swabs a game changer, both in terms of patient comfort and safety for those doing the swabbing.
It's not making patients cough. It's not making them like expectorate. That was a big concern with the PPE that we were before. We'd have our masks and it would be like, there'd be like specks on our mask.
Nearly 62,000 people have been tested for the coronavirus in Philadelphia. The city's health commissioner continues to say he'd like to see at least 5,000 people tested a day in order to get an accurate scope of the virus.
Most of the tests are done where you put the swab into what's called the nasopharynx. That's the back of the nose. There is a new technology where you can just put it in the front of the nose. It makes it a little easier for people to collect the sample. And some laboratories are taking those samples and able to do tests. That's one of the ways in which make it easier for testing to be done.
These smaller, faster swabs take 2 to 4 days to deliver results. A nice pairing as the city scales its ability to track confirmed infections.
You have job postings right now the Department of Health does for contact tracers. How many people do you want to hire, and what are the skills that you're looking for?
We're not sure exactly how many we're going to hire because it's unclear how much funding we're going to have and how much we'll have to rely on volunteer organizations. The primary skills we're looking for really are interpersonal skills. These are people who are going to have to interview folks, find out where they were, where they spent time, get information that may be somewhat private, and then follow up and talk to other people who've been exposed and deal with people's fears and concerns and give them appropriate information.
And the only real question that the doctors and nurses who are using this new swab have is whether or not it will ultimately be as sensitive as the old swabs in detecting the coronavirus. They say even if it isn't quite as sensitive, they say the scale of the testing, the fact that they can do so many more tests more quickly, will make a difference. That's the latest from Philadelphia. I'm Mitch Blocker, NBC 10 News.
All right, Mitch, thank you for that. A